Hello again. Today we will move on to talk about some other factors that could cause mental illness. I will focus on two things. One is environmental factors and the other is childhood trauma. Environmental factors play a crucial role in developmental health disorders, such as adverse childhood experiences. People can grow in war, they might not have direct trauma or witness trauma, but the general environment affected, as well as sometimes natural disasters such as hurricanes, fires, and the like. Other important things are abuse and neglect of children. We will talk about abuse in general as it relates to post-traumatic stress disorder. However, it is very important to discriminate between someone having been abused or witnessed abuse and having developing post-traumatic stress disorder, because there are people who have been abused or witnessed abuse and don't develop PTSD, or develop it and recover from it quickly as resilience and support make them heal, and others that could have witnessed less abuse than the person we talked about earlier and not develop PTSD at all. But we will get into that later on. There are other things as house dysfunction, family dysfunction, divorce. All these can impact mental well-being later in life. There are other things like other ongoing stressors. Violence and discrimination can definitely contribute to these conditions, and the relationship between genetics and the environment are complex, with both factors influencing individuals' susceptibility. We said we're gonna talk about childhood trauma. Childhood trauma can alter brain development and disrupt healthy coping mechanism, and as I said, not necessarily developing post-traumatic stress disorder, but increase the risk, which can develop later on in life, and at times it could cause error in development, causing personality disorders. One of the issues that I like to mention is if you ask a patient whether they witness trauma or not, some of them will say yes, and they'll tell you about the trauma they witnessed. However, other people have been through trauma, witnessed or experienced trauma, but they don't necessarily call it such. Meaning, you want to ask the patient, do you have anything in your life that you feel affected you and caused you distress right now, without using the word trauma or the PTSD designation. To illustrate that with a case, I had seen somebody who was a young man and has been in treatment for some time. When I talked to him and evaluated him, he did mention to me having a very stressful relationship with his father, but when I asked him if he had experienced any event that led to him affecting him for the rest of his life, he became very emotional and discussed with me how his younger brother developed cancer when he was 7, his brother's was 5, but the attention and the stress that put on the family made him feel very neglected and isolated, and he clearly has post-traumatic stress disorder in his 20s relating to that, and affected his relationship with his father that became damaged permanently. So it is very important to make these distinctions and be general about asking people's experience of trauma without saying, have you been traumatized, or having an open-ended questions like that, but be very specific. As people can, again, have trauma, but not have post-traumatic stress disorder. So trauma is a necessary, but not an adequate cause of developing post-traumatic stress disorder. I hope this was beneficial. We will have more about the other factors that can cause development of mental illness in the next few days. And the next things we'll talk about will be substance abuse and chronic illness. And then we will devote a full period to talk about stress and traumatic events, as well as post-traumatic stress disorder. Thank you.